Now, I would like to welcome Dr. Maria Kapsokefalou from the Agricultural University of Athens. Dr. Kapsokefalou, the floor is yours.
Thank you. Good morning. Good morning, everyone, dear organizers, dear attendees, dear colleagues. I'm very glad that I'm following the presentation of Professor Vasiliou. We collaborate on this institute actually from the very beginning in the nutritional pillar is my coordinating role. So I'm very happy that this is presented today. And I'm following with some views on what is the nutritionist able to offer in support of olives. So let me present you some facts and challenges from my point of view. If you do a simple search in the internet on the health benefits of olives, you find lots of information and some rather strong statements such as cancer prevention, eye health, or gut health. These statements are health claims. And the fact is that in the EU and also in the US, the framework on health claims is very, very strict. There are processes, there are scientific criteria, committees, legislation that create a framework that does not give lots of room for expressing things that are not supported by solid science. You may say that we have gone to the other end, but the fact is that there are no authorized health claims for olives. So on your product, there is nothing that leaves a room of expression on a health benefit for olives. Another fact is that on olive oil, you can use only one health claim that is related to the polyphenol content of olive oil. And another fact is that in the EU and also in the US, claims are product specific, which means that even if you have an olive fruit that contains the amount of polyphenols that would allow you to make a claim if you would be able to find this amount in olive oil, you cannot do it on olives. So this leaves olives with no opportunity to express a health claim. So a challenge is for us to create enough science, enough data, pool resources, funding, people, infrastructure in order to produce this kind of claims. Another opportunity, though, is to express nutrition claims. These are claims that are related to the content of olives on certain nutrients that have a beneficial or a non-beneficial effect, respectively, for example, fiber or salt. How far can we go with that? We analyze in a recent research olives in the Greek market. We found 47 products. In these 47 products, only 5 may have a nutrition claim. 3 of those on salt, lower salt, 1 on fiber, source of fiber, 1 on vitamin E, source of vitamin E. So this is an opportunity that has not been enough used in support of the products. So beyond health and nutrition claims, what else can we do to support the product? Challenge number 1, emphasize olives as a component of the Mediterranean dietary model. Olives are on the very definition of what the Mediterranean is. If you look at Brodel, the Mediterranean commences at the first olive grove. So olives are part of our land, of our culture, of course, of our diet as well. And this was very early recorded in the 50s by Ansel Keys in his famous 7-country studies that linked for the first time the dietary quality with prevention of chronic disease. An important moment for Mediterranean diet was in 2010 when we were able to inscribe Mediterranean diet in the list of UNESCO for intangible cultural heritage of humanity. And why was this important? Not only because we entered the list, but also because we managed to create a network among Mediterranean countries that highlights similarities and set aside differences. And of course, in similarities, olives, and you can see olives in these pictures taken from the site of UNESCO, are highlighted. But now we are in front of a second challenge: to emphasize the Mediterranean diet as a sustainable food system or a sustainable dietary model. What does this mean? Already in 2014, the high-level panel of experts of FAO put together this scheme that is, of course, very complicated, but shows very nicely that our behavior, shown here in the Greek box as consumer behavior, is a result of an interaction of a variety of factors that are called drivers or environments. This behavior affects our diet, and our diet has nutrition and health outcomes and also impacts on society, on economy, and the environment. And this comes back to reshape these factors and our behavior. For the Mediterranean dietary model, this is a great opportunity because the Mediterranean diet can be shown to be a model that not only produces public health benefits, but also has low environmental impact, significant economic gains at the local market, and supports further social, cultural understanding and connections. If you look at this so-called double pyramid model, you can see that in the Mediterranean diet, foods that have a lower footprint for the environment are consumed more frequently than those that have a high one. And olives are very much to the lower part of this pyramid. In the new model of Mediterranean diet pyramid, which shows environmental and sustainability traits of this model, you can see olives to be very much highlighted and connected with lower environmental impact, and also the other activities that highlight the Mediterranean lifestyle. We all now talk about the planetary health diets, and this is an example from the Eat Lancel report that was put together 2 years ago that shows that our diet should contain more of a plant source, more plant foods than ever before. Have we used these messages on the olive products? We do not use them as we should. And if you look at the Greek market again, only 2% of those products show that this is a vegan food. Very few have claims like natural. Very few highlight that they're produced locally. Very few have environmental claims. And my opinion is that this is an area that should be further exploited. Challenge number 3 on olives. We have a great concern on their salt content. In sustainable development goals, goal number 3 is referring to good health and well-being, and specifically states that our goal is to reduce by 1/3 premature mortality from non-communicable diseases. Hypertension, highly linked with salt intake, is one of those diseases. Therefore, there is a goal by the WHO to reduce salt intake by 30%. This means that we should consume foods that have lower salt, or we should reformulate, that is, create a new foods that are based on the old foods, but they have lower salt content, that is, that we redesign the food. What is the salt content of olives? Again, we looked at the Greek market, and we saw that the salt content is relatively high. Therefore, if you would use the traffic light system that is used in the UK, most of our products would be labeled as red, that is, that they would discourage the consumer to buy the products. If we look at the trends in IFT, self-care, disease prevention is one of the top trends. Planetary and societal care also. To win the current marketplace, product development must focus on these priorities. We see the same top 5 trends in agro-food industry in Europe according to EIT Food. For 2021, health, for example, sustainability are among the top 5 trends. There are new opportunities in the farm to fork strategy. There are, and you can see those in this wheel. And if you connect to what we said about sustainable nutrition, the message is there. So innovation, my opinion, innovation not only on how the product is shaped, but also on how the product is promoted is the big challenge for the olive sector, apart, of course, for investing more resources in creating appropriate health and nutrition claims. Thank you.
Thank you very much, Dr. Kapsokefalou.